So we've been focusing on the brain and we've been thinking with our brain, but for this coming half an hour, I want us all to reset what we are as humans, because it's a great privilege to have this half an hour with Dr. Rex Marco. Rex is professor of the Department of Orthopedics here at McGovern Medical School at UTHealth, highly accomplished orthopedic surgeon specializing in musculoskeletal oncology, reconstructive spine surgery. Born in California, he graduated magna cum laude from UC Irvine, completed the research fellowship at the Howard Hughes Medical Institute, earned his MD from UCLA, and post-grad training included orthopedic surgical residency at UC Davis and fellowships in musculoskeletal oncology at Memorial Sloan Kettering, reconstructive spine surgery at Rush Presbyterian St. Luke, and has been appointed University of Texas, MD Anderson, Houston Methodist next door to us, and most recently he returned to UT, which is where I met him actually quite recently. I had heard so many things about Rex, where he now serves as professor and director of the Orthopedic Spine Fellowship in Orthopedic Surgery. Now, of course, nobody plans these things and life throws you curveballs, and his curveball, of course, was in 2019, a mountain biking accident, and I'm sure he's going to be talking about that. And he now serves as a chief medical ambassador at the Christopher and Dana Reeve Foundation, focusing on spinal cord injury research, quality of life improvement for devastating spinal cord injury. He has practiced mindfulness since 2015, and he integrates mindfulness into his professional and personal life and shares his journey through various speaking engagements. And he has, of course, taken a keen interest furthermore in medical research, has more than 350 presentations, articles, textbook publications, enormous, wonderful educator, has trained 100 orthopedic surgery residents, 25 spine fellows, received numerous awards, and has made enormous contributions to the field. I am not an orthopedic surgeon, and I have not known him in that capacity. I've just known him as an incredible human being, and I thought this audience would learn and probably, hopefully, feel a lot after listening to him. So Rex, it's again enormous pleasure to have you here. The audience is yours.
Thank you so much, Jacques. And this is such an honor to speak in front of this prestigious group and in front of Professor Sammy. I have a question for you. How many therapists does it take to change a light bulb? One, but that light bulb really has to want to change. And this light bulb did not want to change. 5 years before my accident, I felt I was living the American dream. My family and I had just returned from a medical mission trip. I was living in a house that was more beautiful than I could ever have imagined. I was driving the truck of my dreams, and I had just been promoted to the vice chairman of orthopedic surgery. And then tragedy hit my family. And I soon realized that me and every one of my family members was suffering from a life-threatening illness. I can't speak about their issues. I can tell you about mine. They were almost all stress-related, stress that I didn't even realize I had. I had hypertension, prediabetes, insomnia, unrecognized anxiety, and unrecognized depression. And I was experiencing a tremendous amount of emotional pain as a result of a traumatic divorce. And it was around that time that I was introduced to a book by Alan Watts called The Wisdom of Insecurity. And in that book, he talks about mindfulness and living in the present moment and not dwelling on the past or worrying about the future. Next slide. Next slide. I then found this book called This Moment is Full of Wonders by Thich Nhat Hanh. And I opened up to the first page, and it said, breathe. And I'll invite you to close your eyes and have a slightly downward gaze. And breathe. And the next page said, breathe, my dear. And the next page said, listen. In the last few moments of this meditation, take a few more deep breaths. And when you're ready, come back to the room and open your eyes. I then took a course called Mindfulness-Based Stress Reduction and downloaded an app, a mindfulness app, and started practicing mindfulness exercises. And soon I could find peace and serenity no matter what was going on in my life. And I started practicing one of my favorite things. As I was scrubbing into the operating room, I would turn on the water and close my eyes. And on my next in-breath, I would smell. And on my next out-breath, I would taste. And on my next in-breath, I would listen. And on my next out-breath, I would feel. And I kept doing this until I was ready to go into the operating room. And soon, my blood pressure normalized. My A1C normalized. And I was able to sleep through the night. And I had felt like I had found equanimity, which is the ability to feel calm, even in difficult situations. What I didn't realize is that I was in a spiritual bypass. And I came to that realization when I was on a family retreat. And there was chaos all around me. And I felt peace and serenity. And I thought I had the solution. And when I read the therapist's final evaluation, she said, "I'm concerned that you may never experience the fullness of an emotional life, and that you may benefit from individual therapy." And I was devastated because I had thought I'd found the solution. And so I looked deeply, and I realized that I've been suppressing all of my emotions for my whole life. I couldn't feel. And I found this course by Tara Brach, which is contained within her book called Radical Compassion. And in that course and in this book, she taught me how to reign, where the R stands for recognize. Recognize that I am experiencing a difficult emotion like fear or anger or sadness. And the A stands for allow. Allow that emotion to occur without resistance. And the I is to investigate where in my body I feel that emotion. And the M is to nurture that emotion. And for me, I nurtured it with deep breaths. Slide. I soon enrolled in a parent-driven recovery program. I enrolled in that program to help save one of my children. What I soon realized is that I needed recovery as much, if not more, than my child for my severe codependency. And I learned so many tools from this group and this work. And it was with this group that I went on a mountain bike ride. Next slide. It was on a trail like this, and as I was riding, I looked down and I saw a hole. And I knew my bike would roll right over the hole. And as I was going over the hole, the next thing I noticed was I heard a crack. And I wasn't sure what that crack was. I thought it could be my helmet, or my skull, or my neck. So I kept my eyes closed and started to breathe. And on my next in-breath, I smelled And on my next out breath, I tasted. And on my next in breath, I listened. And on my next out breath, I felt. And as I was breathing, the title of this book that I hadn't read yet came to mind. It was called Radical Acceptance. And I knew it was important for me to radically accept whatever that crack was. And I also knew that I could ask to be granted the serenity to accept the things I cannot change, and the courage to change the things I can, and the wisdom to know the difference. As I continued to breathe, I heard my friend yelling my name in a panicked voice. And I asked him to touch my foot and tell me if it was moving. And he told me he was touching my foot and it wasn't moving. And I couldn't feel him. I knew that in that moment I was paralyzed, and that crack may be my back. And I asked him to tell me if my hand was moving. And he told me it wasn't. And I couldn't feel him. And I knew that crack was my neck. And I knew in that moment that there was less than 5% chance that I would ever walk again. I knew I may never operate again. And I knew I may never hold my unborn child or hug my other children. And I also knew that it was important for me to get to the hospital as soon as I can. And so I helped coordinate my rescue and taught the teams how to keep my spine immobilized and move me back up onto the trail so that the EMS team could get me to the operating room. Next slide. And these are my slides. And miraculously, I was in the operating room within 2.5 hours of my injury at the same place that 5 years before it was difficult for me to get into the OR within 24 hours. And when I woke up in the ICU after my operation, my surgeon showed me my images of a beautiful reduction in instrumentation. And he said to me, with your level of injury and severity, many people benefit from a tracheostomy. So I took a deep breath, and there was nothing. That amazing, beautiful thing that had given me such peace and serenity was gone. Life had taken my breath away. My recovery had given me so many other tools to find peace. Next slide. And thankfully, I started using the Panda Planner 2 weeks before my accident. And this is a tool designed to promote and cultivate optimism. And in that planner, we write down every morning 3 things I'm grateful for, 3 things I'm excited for, a daily focus, and a daily affirmation. And the 3 things I was grateful for before my accident and every day after my accident. I'm grateful for breath. And even though I couldn't breathe on my own, I was grateful for every breath my ventilator gave me. I am grateful for life. And I am grateful for my recovery program, which gives me good, orderly direction. The things I'm excited for, I'm excited to see my family. I'm excited to see my friends. I'm excited to see my caregivers, my doctors, my nurses, my therapists, and my caregivers. My daily focus is to do my best, to be mindful, and live in the present moment, and not dwell on the past or worry about the future. And my daily affirmation is, I am enough. I am enough. Because I didn't always feel like I was enough. And now I know I am. I also started my day and start my day with a loving kindness practice. And I say the following phrases. May I be kind and compassionate. May I be humble and accepting. May I be honest and accountable. May I be forgiving and committed. May I love kindly and kindly love. And in that way, I can start my day from a better place. Next slide. While I was lying there in the ICU, I had a vision of Christopher Reeve at the Oscars in his wheelchair, addressing his peers. And he gave me courage back then. He continues to give me courage now. I never asked myself why this happened, because I knew there was a plan. And I thought that part of the plan would be to increase awareness around spinal cord injury, around mental health. And I also thought that part of that plan would be to raise money for research to find cures for spinal cord injury. Next slide. What I didn't know is that part of that plan was to share with you what I learned about being a doctor by being a patient. And one of the most important things I learned was to praise my team. Because before my injury, I never did that. Because I thought I was the most important part of the team, and that the other people didn't matter as much as me. What I now know is that everybody on the team matters as much as I do. My nurses, my therapists, my caregivers. And what I realized was that I saw the person that cleaned my room more than I saw my surgeon. And so I would encourage you to praise and thank your team. Next slide. What I also learned is that as a patient, we're grieving loss. Maybe it's the loss of a pain-free existence, or the loss of function, or the loss of life. And I also realized that all of these stages of grief, including fear, which is the F, were difficult for me to be with when my patients were grieving. I couldn't be with their fear, or their denial, or their anger, or bargaining, or depression and sadness. The only thing I felt comfortable being with was their acceptance. And I would take on their stages and deny their reality and try to fix them. And I couldn't be with them. And since my accident, I came up with this escape key acronym. Next slide. Where the E stands for empathy, and the S stands for sympathy, and the C stands for compassion. Where empathy to me means the ability to feel and understand what someone may be experiencing from their loss without taking it on and simply being with it. And sympathy is the ability to feel sorrow or deep sadness for what someone may be experiencing. In my medical school, I learned to never say, "You're sorry." And what I've learned from my accident is, it's okay to say, "I'm sorry." I'm sorry that you're going through this. And I can't imagine what it must feel like to have this happen. And C is compassion, and truly desiring that nobody suffers, including myself. Next slide. What I also learned is that hope is an option. Before recovery, I never gave my patients hope. I didn't want to give them false hope. And from the moment I knew that I had less than 5% chance of ever walking again, I had hope that I would be in that 5%. My friend and patient who lives with quadriplegia gave me hope that I would return to the operating room. And my other friend who lives with quadriplegia and ran the Department of Orthopedic Surgery and Neurosurgery and PM&R gave me hope that I would drive to work again. And the new neuromodulation transcutaneous targeted epidural stimulation research and investigations that are improving strength and function in so many people with spinal cord injuries and quadriplegia gives me hope that neuromodulation will help all of us. And it's a direct result of your efforts from your departments and our colleagues, the research monies that we have been able to raise and put towards our passion to finding cures for paralysis, spinal cord injuries, facial paralysis, all the paralysis that can occur from the diseases that we take care of. Next slide. And my hope for you is that in the upcoming days, you take a moment of presence And take a deep breath. That you take a moment to thank your team. And that you consider pressing the escape key and being with empathy and sympathy and compassion with your patients. That you consider hope as an option. Because as Christopher Reeve taught me, when you choose hope, anything is possible. Thank you so much for this wonderful opportunity. One moment, John. May I have the next slide? Thank you. Okay.
Take a picture. Rex, you see what you've done. I dare to say you're much more useful to humanity now than you were as an orthopedic surgeon. I'm sorry to say. Unbelievable. I didn't know what to get you, but I thought I'll get you this poem. I don't know if you know it. It's handcrafted in North Carolina of a living tree around dead wood. Invictus. For those of you who don't know the poem, I'm going to read it. Out of the night that covers me, black as the pit, from pole to pole, I thank whatever gods may be for my unconquerable soul. In the fell clutch of circumstance, I have not winced nor cried aloud. Under the bludgeonings of chance, my head is bloody but unbowed. Beyond this place of wrath and tears looms but the horror of the shade, and yet the menace of the years finds and shall find me unafraid. It matters not how straight the gate, how charged with punishments the scroll. I am the master of my fate. I am the captain of my soul. You're a great captain.